The Executive Director, Lagos Health Summit, Moshood Habib. And also in the studio is a Special Advisor, Lagos Health Summit, Yishau Azizat. Good morning. Thank you for joining us on TVC Breakfast. Let's begin with the opportunities that the COVID-19 produced as a result of the pandemic. We just talked about the fact that people could explore using technology. And now when we bring it back home to our scene, that is Nigeria, what are the gaps we see technology-wise that we think that this conversation is necessary to have so that we can bridge the gap?
All right, thank you so much. To start with, technology itself can be largely divided into both core and digital technology.
Right.
So starting with the digital technology, it has really played a very important role, most importantly in optimizing our healthcare system to fight the pandemic. Contact tracing has been made easier through phone calls and internet services. So the first gaps we can notice is internet usage itself. It's quite costly here. It's not made available to everyone. And then sometimes our communications, it's not really strengthened. People have network issues sometimes, so it has made contact tracing a bit harder. But nevertheless, it's still important to note that it has played a vital role in helping combating the spread of the pandemic. Then going on to core technologies, there was some time that we almost had shortage of ventilators. Hospitals needed more oxygens, and these things can actually be made easier if we actually bring in technological innovations that will make it accessible to everyone. So both core and digital technology have really played an important role, and if we are to look at gaps that are between them, we are going to look at it from this perspective.
So to you now, let's also ask why this is a critical time to have this conversation, because you are part of those putting this together.
Yes, thank you so much. So I'd just like to leverage on what Moshood had said, that during the pandemic, we used a lot of technology. We used a lot of internet, we used our phone a lot to contact trace people, to ask people to register, to come take samples. So technology and health tech actually made it easier for us to arrange ourselves and get a focus. So particularly speaking, I think the word we use in the health world, we call it telemedicine.
Yes.
And so if you look at some of the things that Lagos State government and other states have already put in place to enhance, patients to get access directly to doctors without having come straight to the hospital, because then we're trying to reduce the amount of crowd in the hospital. And a lot of people have access to smartphones and have access to internet to some level. So we were able to reduce the number of people coming to the hospital seeking for health care, and then it was easier for for citizens or patients to also look at other means of accessing orthodox care aside from coming straight to the hospital.
So you think a lot of people have embraced or are embracing telemedicine?
Yes, I think gradually. It might not be to a percentage that we are satisfied about, because just like Moshood has mentioned, we have some challenges even to the access to internet or adequate internet or to afford internet. But a lot of people are now asking the questions, are downloading there are a lot of telemedicine app here. I can mention 4 or 5 that are even improving the economy or bringing much investors into the healthcare system. So people are embracing it. People have 1 or 2 apps to tell them what to do. You understand, when they have this, what to get adequate information on COVID-19, other infectious disease and stuff like that. So a lot of people are enjoying themselves and warming up to the idea of telemedicine.
Let's look at the agenda for this summit. Again, we must establish that this is the second edition of the summit, and it would be happening June the 16th through the 17th. And there is an agenda, 14 of them, that you're focusing on. And one of it is improving data collection through electronic medical recording. And we know what data is right now. Data is the gold that we see in the world today. But then as a country, we haven't done much exploring data, and gathering and management of data is said to be very abysmally low. We are poor with that. How do you intend to address this?
All right, so the first thing is identifying the challenges that electronic medical records are facing in Nigeria is number one. It has not really been adopted because in data collection, in different healthcare systems from the primary healthcare level. We have some primary healthcare centers that probably do not have an opportunity for you to. So in building a technological innovation, you need to look at the acceptability and the usage.
Right.
So for places that probably do not have the electronic record system, can we do a manual record there? Then we go back there later. At the end of the day, they record it into a cloud system. That's the first one. And cloud systems themselves are much expensive to run. So we need to create a user-friendly platform. That's the first thing. Then the expense, we need more investment into that sector, because without it, we won't be able to access or make it accessible to a wide range set of people. So except we do that, the data we are collecting cannot really be relied upon to help in planning the healthcare system itself. So the first challenges we have identified has to be how it is much expensive to run, and we need more investment in that sector. But it is notable to mention that we have a lot of amazing organizations that are doing well. Ilium Health is an example. So they are exploring different measures that we can actually use to gather data through electronic medical record. They make it easier. So patients from one hospital, you can have everything you need to know about the patient in another hospital without the person having to leave the comfort of his own.
But isn't that breaching the privacy of a patient? Because that is the privacy, that patient or medical doctor or medical personnel agreement, that privacy, isn't that going to breach that?
Yes, thank you so much. That method, actually, sharing of data is not something that is new. We have advanced much better. So before anyone could get any data, there are some data that you would give. Normally, that will be available on a number of platforms or health platforms. Take, for example, your blood group. Even sometimes people in other countries have badges or have on their ID card, the same way you have on your ID card as well. So take for an emergency, there's some certain things that would, for emergency purpose, be available to any health platform. So it's not about trading your information with a third party that has no relevance or whatsoever. And then in a system in Nigeria where if we have a collective system, so your information will only be accessed by a registered health platform that has been verified by the necessary authority, Lagos State Authority or State Authority, or even federal platform. So when we talk about changing data, is very, very, very important in the continuity of a patient's care. And it can also be relevant in terms of when governments are planning budget, they are planning health budget. It gives enough data for government and other health ministries, or even other ministries as well that are interchangeably, such as environment and so on, to plan their budgets, to plan their actions. That, okay, this is what is the most challenge, because now we have data. We're not just assuming, we have accurate data that our next budget is going to focus on this aspect of health, because this is the challenge that what we are facing. So I think that's that.
All right. So let's look at optimizing the use of technology as a public health care tool. What areas are we looking at, and what is the focus this time?
All right. So largely we are looking at informative technology, then use of social media platforms, Facebook, Instagram, Twitter, LinkedIn.
Twitter has been banned.
I'm sorry about that.
Right.
So anyone that you can actually mention. So the importance of this is we need platforms where people actually use daily as a way to teach them or to improve health education. Do you understand? People need to have a lot of knowledge about infectious diseases, and most importantly, preventive medicine is really what we need to do here, because our healthcare system is not that, even healthcare systems that are much developed, the COVID-19 pandemic really make them overwhelmed. So the best thing we can do is to prevent people from falling sick. So by that way, we need to shape their health lifestyle or their lifestyle behavior generally. And a way we can do that is to leverage on informative technology. What we are doing here is an example of the technological advancements. Imagine there were no TVs. Do you understand? So what we can do is the issue we are facing with that is we need people to actually access credible information from medical experts. There's a lot of misinformation going out there, and the best way we can tackle it head-on is when we give people access to right information they actually need. So that's the major component of health education and health promotion at large. So the importance of that agenda is for us to clarify the shared challenges that informative technology and social media generally have been facing in promoting health education in Nigeria and Africa at large.
I say that this summit is West Africa, and I'm wondering why is there a plan to ensure that we collaborate across this West African region, and why is this important, this collaboration?
Thank you very much. Yes, of course, there are plans to collaborate with other people. And I've always said that collaboration is one of the major tools when we come to development. And so a lot of West African countries, we have, even with other countries, but we have similarities. We have what we call double disease burden, so that we have the disease of communicable disease, the burden of communicable disease and non-communicable disease. So, for example, the COVID-19 is a communicable disease, diabetes, hypertension are non-communicable disease. So, bearing in fact that each countries have resources that they can bring for it. If it is either investment resources, if it is either personnel resources, if it is in terms of collaboration, whereby we can magnify our effort and then we can magnify our reach as to the conversation about preventive medicine and how to assess tech. So we have some technologies in Nigeria that are already taking roots in other West African countries, and we have also this information, these other technologies in other West African countries that are also taking hold here in Nigeria as well. So when we cross-carpet the resources that we have or the potential that we have, it is easier because we as a region, we've identified ourselves with one thing or the other. So why don't we work together to solve the health burden that we have? So all in all, the health summit, as it progresses go on, would include these other characters as well, these regional characters, and then other regions, and then the whole of Africa as a whole.
Now, one key issue in the healthcare system is the aspect of funding. I wonder if we are looking to addressing that, especially ensuring that we see the private sector collaboration and participation.
Yeah, thank you so much. It's actually one of the major agenda at the Lagos Health Summit. In fact, currently, for us to bridge the healthcare distribution gap we have in Nigeria, we need worth of $82 billion worth of investment, and the government can't do that alone. So what we actually want to majorly create conversation on is how the government can help support private sector to basically invest into the health sector. Then while they are investing, we need to ensure that their investment are well protected and we explore development opportunities. So those are basically what we want to highlight and discuss largely at the summit. The value of investments and what they're actually beginning in return, because we have over 200 million people in Nigeria, so investing into the health sector is really a profitable thing to do. Then the next thing is, how do we protect those investments? Then we need to organize, we need to understand the regulatory framework, because that is very important. We mentioned electronic medical records the other time, and you brought the ethical dilemma about it. So for you to understand the regulatory framework, why not let's just bring the policymakers and those are actually investing into the health sector at a round table, and we discuss largely, this is the regulatory framework that you'll be working with, and these are the challenges that we are facing with it. How do we come at a common ground? Because the main goal of investing into the health sector is to improve the human capital resources that we have in the country. And healthcare has largely a very important impact on the economy. We saw that during the COVID-19 pandemic.
Yes.
The beginning part of the pandemic nearly slid a lot of countries into recession. So if we don't invest into healthcare to build our healthcare system very well, it is actually counterproductive to our economic development and growth. So one of the agenda at the summit is to actually look at how we can protect investments into the health sector and explore development opportunities.
Now, let me ask, still talking West Africa now, the prospects we see on the region such that we're looking to push this aspect of technology and the healthcare system to addressing issues of healthcare.
Yes, so the prospect would mean opportunities that that are really available, and I think that those opportunities boils down to investment actually. And for Nigeria, I would say that we travel to other countries, to access good healthcare. You understand? And if there's a collaboration and if there's a development in the health sector for Nigeria, then it is possible that we might also be at the receiving end of what health tourism, or people coming into Nigeria to access good healthcare. And when we collaborate with other West African countries or even other countries, then you realize that some of the challenges that you might have in terms of methodology, in terms of expertise, in terms of information that you would need, or even a system to adopt, you understand? When there's cross-carpeting and when there's exchange, you understand, you realize that what you don't have to start from scratch. I'll give an example. There was some talk some months ago that the WHO wanted to buy the patent for the COVID-19 vaccine. And you'll be wondering, what's the benefit? That means that every country that has the potential to develop its own vaccine has the chemical composition and formula to such vaccine. And it is easier for even countries to by then focus on trying to provide that vaccine for their own state rather than waiting, so that is as a result of what collaboration as well. So there are some things that we might be having challenges with in terms of maybe health technology, policy. We have the same demographic of people, we have the same characters of people. And so there's some things that other countries might be getting well that we might not be able to get on our part. And it's only when we sit at a table, when there's a policymaker from Ghana or from another country, or Togo, or even Togo as well, that is, this is what we adopt in our own country that is working for us. Why don't you try this plan as well?
Speaking about policy, are we engaging policymakers with regards to all of this conversation? Because it's not enough to just have this conversation, but then how do we ensure that we see that everything that we have come together to agree that we believe that is going to move the country's healthcare system forward are implemented?
So implementation, like I've mentioned, is very important. We can talk all day if we don't actually bring up actionable plans or strategies together and ensure that they're properly implemented. So the first step is to have the conversation. Then when we are done with that, we all come together to see that, we have discussed about, last year we discussed about health insurance, then we continue sustaining the advocacy about how we can improve health insurance in Nigeria. So, and good enough, currently there is a bill at the National Assembly that will help promote health insurance in Nigeria, and we are actively looking at how that bill is going to be properly implemented. That is a good step in the right direction.
So you're following through?
So we are following through. Yep. That's first one. Then this year, we are talking about how we can strengthen the healthcare system with technology. Once we identify those challenges and we're able to follow up how we can actually come out with policies that will help guide and properly implement them, then our own work is to continue the advocacy and ensure that
stakeholders, especially from the country now, policy makers, basically now, are they part of this conversation this time around?
Yes, they are, just like they were last year too.
Interesting. I think this year, hopefully, at least we'll have a representative of the governor of Lagos State. In as much as we have legislatures in the country, the governor also has, have policies that they make, and then, of course, we have I think we try to get the representative of chairman committee of health for Lagos State House of Assembly. We are still working on that. If there's a response, and then of course we reach out to have these people there. But then at the end of the day, once we have this discussion, just like say we are young people, and most of what we do is advocacy, but we need to sit down with experts.
Absolutely.
To bring forward, okay, this is what is going to come up, and then when we sit at the round table, even with legislators and policymakers, then we can come to an agreement on what is good, because definitely tech is good for health. Tech is good for a lot of things, and that is where we are going. That is what the world is going. So it's not a matter of we can't do tech. The question is, how can we do it? How can we adapt it? How can we provide? How can we protect our citizens? And how can we ensure that we get the best?
How can we improve the whole healthcare system? Like he mentioned earlier, the COVID-19 pandemic has actually overwhelmed the system, and we're looking at ways to improving it. Well, we must thank you so much, Executive Director, Lagos Health Summit, Moshood Habib, as well as Special Advisor, Lagos Health Summit, Yishau Azizat, for your time
Thank you so
on
much.
the program.